Hello, this is Dr. Ian Levinson. I'm the medical director of the Colorado Center for Health and Longevity. And today's video is going to go over three different things. One, we're going to look at virus testing because that seems to be very confusing for people right now. Two, a question and answer that I got from one of the patients that goes over grocery shopping. And three, what's going to happen with the office after Monday, April 27th. So let's start out with virus testing. The virus testing is a little bit confusing, but I'm going to try to explain it to you in a way in which it's fairly simplified. There are two types of testing for the virus. The first is to actually test for the virus itself. This happens in the acute phase. So that's where you see the nasal swabs, or they're coming out with a new test for sputum testing. And that particular type of testing is probably the most accurate during the acute phase when you first get infected. So you're actually culturing for the virus itself. That gets sent off, and then people will say, yes, you have the virus or you don't have the virus for coronavirus or COVID-19. The second way to test is to test antibodies. Now, the antibodies are not accurate during the acute first phase of the disease process, usually during the first 2 or 3 to up to 5 to 7 days, because it takes your body time to build antibodies. So the first antibody your body builds is called IgM antibody. And that's during the acute phase when you have the infection itself. The second phase is building long-term antibody, which we think will build immunity, although everybody's not sure, called IgG antibody. So people say, well, I want to know whether I've had the process, but I really didn't get sick. Or people say I got sick, but I want to know, have I built antibodies or not? That's where antibody testing is helpful. And it will give you IgM, the first antibody, and IgG. So if you have IgM, the first antibody, and not IgG, you have the acute infection. Then what happens is, as you're getting resolved, you have both IgM and IgG. And then once you're over the infection, the IgM fades away and you just have IgG, which is long-term antibody. So we can tell a lot about things from this antibody testing. It's just not as sensitive in the acute phase, because if you did it, say, a day or up to maybe 2 days during which you had the infection early, it would probably get a false negative because you haven't built antibody yet. So that's the testing that's available. The viral testing is much more problematic because you have to take personal protective equipment away from the hospital in order to test somebody, because you can get very easily infected when you're up inside somebody's nose where the virus directly is. So that's a little more problematic to get. The antibody testing is least problematic because this is a respiratory virus, and you're going to get it through direct inhalation or contact with your hands on your face. And so that's a little bit easier to do, and we do that through a blood draw, send that off to a biological lab. So hopefully that is a little more conceptually sound as far as the virus testing is concerned. The second thing is shopping at the grocery store. So I decided in these videos I'm going to start taking questions and answers from patients of mine. So this is a patient that sent me an email, JN. I won't go over who exactly it is, but they wanted to know, what do I do at the grocery store and how do I go to the grocery store? So first of all, I want to stress to you the fact that this is not a GI virus. This is not like hepatitis A or norovirus like you get on a ship. That's a GI, that you ingest the virus and then you get sick from a GI point of view, or you get hepatitis. This is a respiratory virus. Therefore, if you eat the virus, you don't get sick. You get sick from inhaling droplets into your respiratory tree or taking contaminated hands, putting it on your face, and then getting it through your nose or mucous membranes into your respiratory tree. It's not a GI virus. So there's a very distinct difference between that. So when you go to the store, yes, I would go to the store with a mask. If you have gloves, that's fine. If you don't, you don't have to avoid going to the store without gloves, because it's not going to get through your skin as long as you wash your hands afterwards. So you sanitize the cart, you go do your grocery shopping, you come back. Before you go into your car, you either sanitize your hands with hand sanitizer or pull your gloves off like I showed you in the previous video, and then you go about your business going home. You go home, don't set the bags on the counter, and I would have you avoid using reusable bags. Those tend to breed more virus than disposable bags. So for the short term at least, most stores are prohibiting you bringing in your reusable shopping bags because they breed virus. So you go put them on the floor, you take everything off, put it away, and then you want to sanitize the counter and you want to wash your hands. Now, as far as fresh fruit and produce is concerned, yes, I would wash that off with water, but I wouldn't use bleach or other substances. You're going to make more toxic exposure by what you put on the fruit than washing the fruit off with the virus. Again, it's not a GI, it's a respiratory issue. So those would be the things that I would stress. Now, if you want to wipe your cans down or anything, certainly that's not going to hurt, but the likelihood of that being an issue is very low. Now, for people who are interested, just below this video there'll be a little box that you can push, and it'll take you, I have an FDA recommendations from the FDA about all this and grocery shopping that's a little more extensive than what I went into, that you'll be able to access from the video by just pushing that button, and it'll take you to the actual website where the FDA has gone over all of this. The third thing is April 27th, or next Monday. At that point in time, restrictions for medical procedures will be released and will be fully operational at that time. We'll be able to do all elective procedures, we'll be able to do all regenerative procedures, we'll be able to do pelleting hormones, all the vampire procedures, the O shots, the P shots, etc., etc. I would encourage you to contact the office early so that we can accommodate what your particular needs are. As in this particular office, we generally don't have people in the waiting room, and we want to be able to have people in specific rooms so that there's no interaction between people. I want to assure you that we have not had any corona-like illnesses here. We have taken care of emergencies and things that are non-infective. All the infective issues we've done by Zoom teleconferencing or by phone. So we're very comfortable with how the procedures have been here, along with following all the CDC guidelines as far as preparation and sterilization is concerned. If you have any questions or concerns, please feel free to call the office. We're always happy to answer any questions you have. I hope you're staying safe, healthy, and we're looking forward to having things back to semi-normal state and being able to accomplish the medical needs that you have. Thank you, and God bless.